Good afternoon, everybody. I appreciate the opportunity to give you an update on several important things that are going on here at East Jefferson. First and foremost, let me talk about the partnering issue. Yesterday, the Parish Council met, went into executive session, and that session actually lasted about 2 hours. They got a very thorough update from the consultant, Josh Nemzoff, that they hired to review all the proposals. There were a lot of questions asked, a lot of healthy discussion. No decision was made. The consultant's report is going to be completed somewhere in the next 7 to 10 days. There's now a special council meeting set for April 2nd, of which they're going to hear the final report, which right now is planned to be an open session that everyone will be able to hear that. What the council will decide to do with that completed information, whether or not they make a decision that day or not, is yet to be seen, and I don't think we will know for certain until that meeting is completed. As we have been, we commit to give you updates as we go. The last month we've tried not for this to be the focus of what we're paying attention to. What's much more important right now is for all of us to work very, very hard to provide the very best care that we can for our patients, and to make sure that we're getting an acceptable number of patients who want to come to our hospital. I think everybody has really begun pitching in with that, and continuing their efforts is extremely, extremely important. As I said, I think in leadership meeting and on a previous video, we have to plan as if we will not have a partner. We cannot sit and wait. We're sort of way past that, and I think that all the things that we're doing and we will be doing will only put us in a better position if in fact we do have a partner, and if we don't, we'll be able to stand on our own 2 feet. So again, I appreciate everybody's efforts. Second thing I want to talk about is a dependability policy. This policy came from recommendations from the Voice Committee. I think we would all agree, as we've tried to do our jobs, team members who have a consistent pattern of being late, not being on time, hurts everybody. It hurts our patients. It hurts everybody who's working hard. We certainly view it as we want to be very fair, and there are a few details that need to be ironed out yet with that policy, but I think we would all agree that part of doing a good job is being on time, leaving when we're supposed to, and everybody working hard while we're here. So that's the basis of why we're going down the road with this policy. Please stay tuned for the final version of that policy, and we would like your help in enforcing that policy. We've had a lot of very outstanding accomplishments recently. We always have accomplishments. Sometimes in these, it becomes easy in these challenging times not to talk about the good things, but to focus on some of the negatives. We recently received a 2013 Safe Sleep Champion Hospital Award. This has to do with care of patients in our nursery, care of infants. It's trying to help be preventative as it relates to sudden infant death syndrome, and we've made great strides. We have great practice patterns, and we're very fortunate to have received that award. Our patient satisfaction scores have been trending upward. That is obviously a very good thing. You know, at the end of the day, we want our patients and their families to be satisfied with what they're doing, what care they've received, and how they perceive that care to be. Friendliness, caring, doing all that we can to be helpful when they're here, not only the patients that are in the bed, but the patient or their family who's lost out in the hallways. All that we can do to help them make a huge difference of how patients feel about our facility. We recently received a Best Practice Award from the American Cancer Society for our practice of cancer care at this facility. That's a great honor for us. We're also very proud of some nursing awards that we received. 2 of our nurses won statewide honors with the Nursing Nightingale Awards. Brittany Nackery won Rookie of the Year, while Debbie Schmidt won Outstanding Community Achievement by a registered nurse. Great accomplishments, and if you have a chance to congratulate them, please do. We're also proud of our other nominees, Lane Mistretta for Mentor of the Year, and Cindy DuPont for Educator of the Year. Congratulations to them. Earlier this year, we had a DHH survey of our skilled nursing facility, and it had no deficiencies. That is almost unheard of and is a great accomplishment to get a perfect score when somebody's reviewing what you've done. Those come few and far between, and I think that we all should acknowledge the great effort that went in to get that perfect score. We're also looking forward for a Joint Commission survey on our Advanced Primary Care Stroke Center. A lot of effort has gone into that, and also we should feel good about that because strokes can be extremely devastating to patients and their families. We are at the cutting edge of providing very high-level care, as good as anybody else. We meet the requirements and the criteria. Everyone who's been involved with that deserves a lot of congratulations for their work. The Yenny Pavilion's expansion for our Infusion Center is coming to completion. In the next several months, that will be done. That's been a long project. Many of you have donated money to help, or at a minimum been supportive of fundraisers for that facility. It is going to greatly help our patients and their families be in an even more comfortable place getting chemotherapy. I think we would all acknowledge that's a very difficult thing for patients and their families. They have to come to the hospital quite regularly for that, and our new center, the more patient-friendly center, will be of a great aid to the level of care that we are providing to those patients. Surgery is expected to open the new hybrid suite in the very near future. This is a suite that provides cardiac care, has the ability for many different kinds of procedures, including surgery, to be done in that suite. It also moves us to the forefront of what's being done with heart care throughout the country. So that's, again, a really big deal that will bring a lot of accolades to our hospital. As far as mammography goes, we're testing the 3D mammography, and we'll be moving forward with that very, very soon in our breast center. The last thing I would like to mention is as we celebrate success and keep that in balance to some of the challenges that we talked about, I would encourage you to share successes in your department so we can either put it on Team Talk, congratulate that department in a meeting. Recently, Judy Brown, our Executive Vice President and COO, shared our 2013 accomplishments. This is currently available on Team Talk. Judy has shared those in leadership meetings, several board committees, and we'll be sharing them at the board this next Wednesday. When you step back and you look at all the things that have been accomplished this year, it's truly an amazing list, and almost all of them relate to putting the patient first, promoting the high quality of care that we do, and those awards, I think, substantiate everyone's efforts. I think we're moving like we should in this year. The first 2 months, we've been pretty close to budget from a financial perspective, and that's even with a couple bad weather days in January that weren't quite as bad as hurricane days, but very much slowed down and shut down business for a few days. So we will keep you informed on that. Again, we got to keep pushing hard. We have some challenges and hurdles to get over, but again, I think everybody's effort is moving forward in a positive way. The last item I want to end on is that we all tend to hear about the complaints. It's sort of like the problems we talk about versus the accomplishment. And we do receive a lot of letters that are very, very positive. And let me just read one that came to us about a month ago. To Dr. Peters, I have wanted to write this to let you know I have high regards and praise for your hospital and the people who go above and beyond their job description to assist the patients of their necessities. I have been here many times, and each time I have received the same level of care. Please praise them for me and tell them they're doing a great job. The signature is not really relevant. It's the thoughts that come with that. And I think if you think about yourself, the time that it takes to write a complimentary letter most people don't do. And when we're having patients do that, that means that they really were impressed. So I hope keep those in mind. We need to keep sharing those, that I think those are the continuing things that make East Jefferson General Hospital different than our competitors, different than other healthcare providers in the region, and we need to keep raising the bar and pushing harder, and we will continue to be well thought of. Thanks for your efforts, and I commit to keeping you updated. Have a great day.